Well, we used to talk about like your digital experience was your website. Now your digital experience is your website, it's your online reviews, it's your social media. It's also how can I make an appointment online?
Yeah.
Is it 25 pages to make the appointment online?
Right.
What's the follow-up for the appointment?
I have
All of the above.
Right. I have a question. How easy is it to get my question answered?
Is there a chatbot?
Right. I
Is
don't want
that
to pick up the phone.
chatbot a computer? Is it a bot? Or do I have an opportunity to actually get connected with somebody?
Yeah. Can I just text somebody?
Yep.
All of that kind of builds into this experience.
And all of these tools that we're talking about are actually tools that are out there that you can implement together. It's just historically, this has been something that retail is focused on, or restaurants, and not necessarily healthcare. And so I think that the healthcare organizations who are really, moving forward in the trends are the ones who are saying, let's look at my digital strategy. And it's not just about a website, it's about all these connected items to make it easier for the decision maker or the patient. Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I'm Corey.
And today we're going to talk about your brand. And I mean, when I say brand, I mean kind of how your brand is perceived, how you communicate your brand out there in the public. And there's really two kind of key factors here when we're talking about brand that we're thinking about in this moment. One is, how do we have a positive customer experience and let your brand message kind of resonate with that customer experience? And then how do you get to that customer experience? And that's really through kind of your employees and how they're interacting with your brand and how they're kind of conveying it out there in the public. It's really like a three-legged stool, and it's all connected in order to be able to really like perch right there at the top of the stool.
Yeah, and your brand is really kind of, you may have an idea of what your brand is, and you have expectations, and you can set the bar really high for what your brand is. But if the experience is different, then whatever that experience is, that's actually your brand. So we want to talk about what your patients are kind of experiencing and some things to maybe improve that. And then the flip side of that is on the employee front and what can be done there and how they actually can make or break your brand.
Yeah, and we're not just kind of plucking these topics out of the air. The fact is when it comes to brand experience, customer experience and employee experience are really some of the biggest trend factors for 2023. And so as we're looking at what we can do that is really doing more with less, if we start with our brand and the brand message and what we convey, focus on our customers' experience and our employee experience, that's going to give us the biggest bang for our buck as we roll into 23.
Yeah, there's a recent survey that said that 73% of people would decide on a product or a service based on the customer experience. So in other words, if the customer experience is poor, they will leave. And the same goes for healthcare practices. If the patient experience is poor, they will just move on to somewhere else. So we see this more and more every year. This is, we're talking about 2023 trends, but really we've been talking about this sort of patient experience for I don't know how many years now.
Probably 10 years now.
Yeah, and it seems just every year it matters more and more. Part of that is just due to online reviews, but it's also just a change in expectations. And people, they want to be treated as customers and not just patients. And that's a big mindset shift.
Well, it's the whole consumerization of healthcare in general. The fact is we're buying our dinner by looking at reviews. We're making purchase decisions of which roads to drive based on what we're being told to do. Anything and everything we're pulling out a credit card for, or cash, or an insurance claim for. We're taking a look at what those reviews are telling us. Same thing with jobs. The job market, the employer market is not like protected from these online reviews. We're seeing it on Glassdoor, we're seeing it on Indeed, ZipRecruiter. You have a workplace happiness score where you're measured against other individuals. And so I think part of it is, you have your group, the millennial group, but then you have this Gen Z group, and you have the group coming behind. This is what digital first. And we're having to make adjustments from the business model standpoint to meet kind of the new needs of this up and coming generation.
Yeah, it's no longer just about convincing someone to schedule an appointment and go to your practice. Once they're actually there, yeah, you want to obviously provide better outcomes and give them the quality care. But what we're saying is that part of the equation is now this patient experience that's going to keep them coming back for more. So for example, if someone schedules an appointment at your practice and they go in, they have whatever the service is, but the billing is a pain, when they have a question, they have to jump on the portal and then type it in, but it's really like kind of clunky, and then they don't get a response for 4 days, and the response they get is only half of the question, then they have to go back in and there's no notification. All of that's going to add up, and they're going to go, they did take care of my whatever's sprained finger, but all of this is not worth it, so I'm just going to find somewhere else.
Well, we used to talk about like your digital experience was your website. Now your digital experience is your website, it's your online reviews, it's your social media. It's also can I make an appointment online?
Yeah.
Is it 25 pages to make the appointment online?
Right.
What's the follow-up for the appointment?
I have
all of the above.
Right. I have a question. How easy is it to get my question answered?
Is there a chatbot?
Right.
Is that chatbot a computer? Is it a bot? Or do I have an opportunity to actually get connected with somebody?
Yeah. Can I just text somebody?
Yep.
All of that kind of builds into this experience.
And all of these tools that we're talking about are actually tools that are out there that you can implement together. It's just historically, this has been something that retail is focused on, or restaurants, and not necessarily healthcare. And so I think that the healthcare organizations who are really, moving forward in the trends are the ones who are saying, let's look at my digital strategy. And it's not just about a website, it's about all these connected items to make it easier for the decision maker or the patient.
Yeah, and I mean, everybody wants to be heard and seen and valued. And I think in terms of what we're talking about right now, what that really means is these personalized kind of experiences make a difference. So it needs to be easy, and it needs to feel personal, so you don't feel like you're just sort of a number through a factory. If you hear that all the time about healthcare practices, that I just felt like I was in a factory, and I waited forever, and then they moved me along. I got 2 minutes with the doctor, et cetera, et cetera. You hear that time and time again. So the more that you can personalize these experiences, the more that you're going to insulate yourself from any sort of negative feedback. And when that happens, sort of by default, you're building a better patient experience.
So give me an example of a personalized experience that leads to a better customer experience in general.
Yeah, well, I kind of mentioned it a couple minutes ago, but I think that using the chatbots, like you were saying, is a really great way to do that. So if I have a question, there's HIPAA compliant ways to do it, but once you know who you're talking to, then act like you're actually talking to me. Have a conversation with me and not some automated script. Answer my question, make it so you know who I am. And then in office, that's another question we get all the time. I remember a couple months ago, I had to go to the doctor, I had to go to the dermatologist, and they took a note down that I was going to have a daughter. And so when I went back, they asked if we had our daughter yet. And that, it brought a smile to my face. They remembered, and I'm sure it was just a little note that they put on their chart, and it's a small thing, but it adds up, because then I felt like they remembered me. It made me feel a little bit more loyal, and I'm more apt to recommend them.
Absolutely, it's that personalized story. Exactly. And kind of back to your chatbot. So, chatbots no longer have to be just something you pop on the website, check it off your list, oh, we have a chatbot. There are now technologies out there, and all these technologies are relatively inexpensive,
sure,
with the exception of maybe having to integrate with your EHR and do the HL7. But I was talking to a chat provider developed by a physician, and basically you log in, it starts with the bot, and you say, let's say, for example, I want to pay my bill. It directly connects to the billing department. They have it's a page on the website. They get a notification that there's an alert that comes in. That goes, it ties into your record, and it's all HIPAA compliant and completely encrypted. And the billing department's able to respond to the text message, and the end user doesn't know that they're going from billing to scheduling to a physician team, and it all ties into the health record for the patient. So from a patient's experience standpoint, they're able to reach out on the phone. The doctor is even able to call them on an encrypted line, so you don't know that that's the doctor. Able to do telemedicine appointments on the phone that you can bill for, tie it all into the record, and that all stems from a chatbot.
Seamless. Completely
seamless. That's the kind of customer experience we all are expecting. And if your practice can figure out how to deliver that level of customer experience, and really it should be the patient experience first, when you start thinking that way, you differentiate yourself from every other doctor down the road.
Absolutely. And a lot of what we were talking about there is kind of like on the digital side, but like the example that I gave, it also matters for in-office. And when it comes to in-office, I mean, in digital too, we really start to think about what the employee experience is like and what that employee engagement level is, because if the employees aren't engaged or they aren't knowledgeable, they don't know what's going on, or they just don't care, then let's say you have cracked that equation, right, that you were just talking about, and you have automated and you've got this great system, but it goes to the billing department and you've got Rhonda over there and she's just not paying attention to the screen, or she's on break, or she's scrolling through Facebook, well, then it all falls apart. So the role that employees play in your brand cannot be overstated.
No, absolutely. And I think that we oftentimes don't communicate, and it all boils down to communication. We don't communicate that we're focused on patient experience with the employees. So the employees, really, if you start with the employees and you start from the ground up, it becomes the employees' idea. They understand how you can reward employees and how they can participate in the patient's overall experience. And when it starts from them, you're able to actually deliver something that makes sense.
Right. Yeah. And the employees, when you think about it, they are sort of the human face of your brand. So if your brand is, you want to, let's go very broad and say that you want to be efficient and provide great care for everybody that walks in your door. That's the brand that you're going with. Very broad. But if the employees that are in the practice don't live that every day, then you're never going to be able to deliver on the brand. Your brand is going to be whatever their face says it is when that patient walks in.
Well, and I think that's partly indoctrination from day one when you are bringing new employees on. We spend all this money and time and energy on marketing and on really patient experience, but we don't always spend time creating the right experience from day one with our employees. Right. You had an example where you were working with a client at one point trying to help them with a culture book. Could you elaborate a little bit on that?
Yeah, so what they wanted to do is they were getting ready to scale and open up a bunch of different offices. So what they wanted to do was really take what their values were and make it in this really nice, high quality book that they would give to every employee, so that you learn the mission, the values, what the brand stood for, and even a little bit about what the future growth plans were. So you were kind of invested in everything that was going on, what's going on in the community and how they give back. All of that was in this really great piece where we see, time and time again with practices that we work with, new employee comes in and they get a folder, and in the folder is something that looks like it's been Xeroxed from
like
other
times.
copies,
Yep.
Over and over and over again, and they go through that one day orientation, and then they're off to the races, and that's it. Or maybe there's that annual review where you talk about it, but there's not this sort of consistent touch point, and there's not this nice takeaway that you want to go back and read and feel like you're invested in whatever the practice is trying to do.
Yeah, I was just with a practice manager not 20 minutes ago, and we were talking about employee engagement with an initiative that we're focused on, and he was explaining that he really wants in 2023 to make new hires almost an event in and of itself, because their first day, their first week, if it's a positive experience, there's a much higher likelihood they'll stick around.
Yeah.
So he wants to engage existing employees, and he's still working through this idea, but engage existing employees with potentially like a scavenger hunt, all related around a new hire. So you get new hire and existing employees, and it becomes kind of a game the first week, which forces indoctrination into the practice, getting to know kind of the key decision makers, kind of having fun and having an opportunity for rewards. And then it really helps drive home some of the values that they're trying to really educate staff on and get everybody kind of working in the same direction. So just an idea, like new hires, it becomes kind of an event. Granted, he's a big practice and he's got a lot of new employees, and we'll figure out the details, but he wants to put a focus on that new hires first week because he knows it's going to help in engagement and retention.
I like that, yeah. That's a really
Well, good, because you'll probably be working on that
I'm
project.
sure I will.
I'm sure you're going to get it.
I'm also, another example comes to mind, working with a practice that's rolling out a new intranet. And so one of the main things that they wanted to focus on with the intranet, this new one, because they had one previously, and the previous one was fine, but there was no way to recognize employees on it. It was just sort of like, let's post some news and here's some forms and some links, and that's kind of that. So this new intranet, what they want to do is really have a way to reward and recognize employees for what they're doing and have that be very visible to everyone else that's in the practice. So, for example, you're going to be able to award points to folks, and you can post pictures. You can write little social posts. So it almost looks like a social media feed. And then someone from HR is going to go in and then collect all of that and then reward them at the end of whatever it is, weekly, monthly, quarterly, whatever the practice decides. But by doing this, it's a unique way to, again, kind of build that culture around going above and beyond, not only for the patients, but for each other on your team.
Funny, I was just having a conversation about this yesterday with a vendor for a program I'm looking to roll out. And so it's a vendor, they can tie into Microsoft Teams, they can tie into Slack, they can tie into the intranet, and essentially for a couple $100 a month plus the price of the rewards, I can reward you for demonstrating in practice one of our values, and I can award you little points. And those points can be redeemed for local gift cards. They can be redeemed for company swag. They can be redeemed for Amazon gifts, whatever you want. They can go on and have things delivered to your house. Other employees can recognize you when you really show the values that we live by. And we can set up little challenges. So we could have challenges like anybody who reaches 10,000 steps a day can get X amount of points. Anybody who drinks 8 glasses of water gets X amount of points. Things that are related to healthcare or things that we just want people to focus on, we can do that, and we can automatically set up those reminders that somebody's anniversary, they've been with us 10 years, we can give out points that way. You set the points based on the budget, it all integrates. These are things that are a couple $100 a month, but the dividends that they're paying and the engagement that you're getting and the chance that recognition isn't just from the top down, it's from your teammates that are recognizing you as well, all for people who are focused on our values.
Yeah. I love that. That's awesome.
Well, I sent it to you yesterday so you can look.
And if, great, I will.
Yeah.
If that sounds like a lot of work, I think that an easy way to start is just, small things like go to Target and get a couple of $5 gift cards, and then when you see an employee do something, give them a gift card, and then that's gonna spread, and people are gonna know that is a new initiatives and small things, but it adds up, and that can really take, again, small steps, big improvements for employee engagement.
That's absolutely the case. I've got a last example. I've got a project that I'm working on based around the book Culture by Design. It's a large practice, and they are getting ready. They've spent the last 6 months or so outlining their kind of the fundamentals they live by. They've come up with 25 key values. It's a lot.
It's a lot of values.
But the idea being that in 2023, we're going to focus on a different value probably every other week, something to that effect. And I was with the practice manager this morning showing him kind of they're going to roll it out with town halls for all of their employees, showing him the handout that's got the 25 values that people can kind of hang up in their cubicle. Then we were looking at the graphics that are going to go on all the lobby videos. So for this practice, I have lobby videos, but we also have videos in all the break rooms. So we can reinforce the fundamental in the break rooms with the employees, so they're getting a consistent message. Because again, it's all communication.
Right.
We have little packets that are going to be delivered to each of the offices that the branch manager can then use to distribute and put things up. And then finally, we're going to end it with, I showed him 2 examples of cultural books where it's maybe 25 to 50 pages, and it's really outlining the culture of the practice and putting pictures of the employees in there or pictures of the practice and making it a nice, tangible piece to show that our people are important, and we're going to show images of them really delivering on those core values and focused on that patient experience. So I think it's whether you're spending $5 or $5,000, the point is you have to, if we're so focused on patient experience, we have to start with employee experience. And if we can do that, with kind of the root of it being our brand and communication, we're going to be that much closer to achieving our goals.
Yeah, absolutely. And it all kind of goes back to that idea that, you see it again if you just Google anything related to employee engagement. bad attitudes are one of the number one reasons why people will take their business elsewhere. So if you can improve the attitude of your employees, you're going to provide a better patient experience, and then rising tide lifts all boats.
That's right. So with that, I'm Jennifer.
I'm Corey.
See you next time on the Dr. Marketing Tips Show. Thanks a bunch.
Thanks, guys.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.